So we're going to do head-to-toe assessment. We're going to start at the head. We're first going to inspect, look, make sure there's no abnormalities, no deformities. And then we're going to palpate, feel the temperature, feel for any deformities. So we're going to start with the head in general, scalp, make sure we don't feel anything. And move to the temporomandibular joint here. You open your mouth, close. Perfect. Then we're going to palpate for the sinuses, make sure there's no inflammation, swelling, that it doesn't hurt when we press on it. Lift up the process for a second. And the maxillary as well. Make sure it doesn't hurt with pressure. All this feel normal. I feel no swelling, feel no tenderness. Are you feeling any pain whenever I'm pushing there? This is good there. So then we are going to look at the cervical lymph nodes. We're going to start with the posterior ocular, which is actually going to be behind the ear. We're going to work our way down. Check for any swelling, inflammation. Then we are going to move to the front. Work our way down. Check there. No swelling, no inflammation, no tenderness on that. So we're going to palpate and feel for the cervical lymph nodes. We're going to start with the posterior ocular, move down to the occipital, and we're going to continue to travel down the neck on each side. So we're going to be feeling for the superficial cervical, the deep cervical, and the posterior cervical on that. And then we're going to go down all the way to the supraclavicular, which would be right here. Feel for any swelling, tenderness, or anything like that. Then we'll start the front with the preocular and the parotid. Move our way down to the submandibular, all the way up. The submental and the submandibular, all the way up through. So we're now going to use the otoscope. Look at the eyes. We're going to make sure we're coming from the side, getting the red reflex as we're coming in, looking for the optic disc. We're going to do that on both eyes. Look to see if we see any nerve damage within any of the vessels within the eye. And then we're going to switch over. Make sure to look into our ears now. Make sure we're our hand here so that we can make sure we're not lifting anything. So this we're looking for the inner ear, looking for any infection, seeing if we can see any swelling, inflammation. Everything looks good. So our next assessment is going to be our lungs and thorax. One of the first things to inspect, something that we would be looking for in this situation would be a barrel chest, which would be if our transverse diameter was the same as our anterior posterior diameter. So they should be 2 to 1. If they were 1 to 1, that could signify something like a chronic pulmonary disease. So then after we inspect, we're going to palpate, see if we can feel any crepitus, any kind of subacute area, subacute tissue, anything like that. After we palpate, we are going to auscultate. We'll start with the front. We're going to make sure to do this bilaterally. Listen for any adventitious breath sounds. Take a deep breath. Let out. And again. And listen on each side. Continue to do it bilaterally all the way down. Once we've done that, we're going to have them sit up so that we can feel the back, look at the back. Put our hands here, take a deep breath. And we're going to listen down as well. Deep breath. Alright, so it's not normal, but we would be looking for crackles, which is kind of like almost like a wet sound. Wheezes, which are usually heard more on expiration, which would kind of be like a high pitch. Rubs, which are almost like a leathery pitch, like two things kind of rubbing together. Or stridor, which is usually heard on inspiration, which is also similar to a wheeze, but it's louder, and again more on inspiration instead of expiration. So then as we're doing our physical assessment, we can have our patient stand up. In those situations, we would be looking for something such as scoliosis, which would be like an S shape of the spine, or kyphosis, which would be what we call hunchback, or a protruding of the thoracic spine. We could also be looking for pectus excavatum, which would be a protrusion of the sternal area right here, also known as pigeon-chested for layman's terms, or that's pectus carinatum. Pectus excavatum is if the chest was sunken in. And usually those last two are not symptomatic but not issues, but you can actually have selective surgery to have it fixed. So the next thing we're going to do is listen for heart sounds or cardiac sounds. So we are going to listen in 4 different places. We're going to be listening over each of our valves. So some of the best ways to do this are either to have them sitting upright or supine. So we're going to check them this way first. So we are going to listen over the aortic valve first. We're going to move to the pulmonic. We're going to go to Erb's point, which is going to be where our mitral valve is. Then we're going to listen over the tricuspid. And then the mitral area. So we can have our patient turn a little bit up to their left side, known as the left lateral recurrent or left lateral decubitus, depending on which way you want to look at it. So this is one of the places we're going to listen more for like an S3 and S4 sound for possibly systolic or diastolic heart failure. Here. We're going to listen to those same places, just hearing if we can hear any extra heart sounds. So when they're in the left lateral recurrent, we're going to listen in those same places, see if we can hear any of those extra heart sounds, the S3, the S4 for the possible heart failure, whether it could be systolic or diastolic, or whether they might have a murmur or any kind of regurg. It sometimes helps to amplify those sounds. Here we have a normal rhythm with just the lub dub, no extra sounds. So the next thing we're going to check with the cardiovascular system is pulses. So we're going to palpate and auscultate the carotid arteries. Definitely not going to do them at the same time. So on this side. Right here. We listen for any thrills or bruits. Make sure we get clear sound through. We're going to check our pulses throughout our system. We're going to start with radial pulses. We're going to move up to our brachial pulses. We're going to check our popliteal pulses. to check our dorsalis pedis and our posterior tibial pieces. Everything is normal and present on each side. And then we're going to move on to our abdominal exam. So our abdominal exam is going to be a little bit different because the first thing we're going to do is inspect. So we're going to look for if it's any kind of rounding, look for any kind of abnormality, see if we see any unwarranted bruises. And then we're going to auscultate before we palpate or before we percuss, because we don't want to start moving things before. We want to see if they're moving on their own. We're going to listen in all 4 quadrants. So the other thing we're going to listen for while we're doing this is the arteries. So as we're doing that, we can listen for the right and left renal artery, the right and left iliac artery at the same time that we can do our quadrant. And the one thing we have to go back and do is listen for our aorta, because it's going to be more midline. And again, we'd be looking for thrills and bruits and that. Any indications of an aneurysm or a dissection that you might be able to hear in those areas. So once we've done that with our auscultation, we can then begin to palpate. So we're going to palpate the same as we listen in each quadrant. And then we're going to percuss over. So the other thing we're going to do is palpate our liver. So we're going to make sure they're laying flat. We're going to find the bottom ribs. We're going to have them take a deep breath in. And then we're going to have them breathe out. And as they breathe out, we're going to kind of hook under and feel. Once we've done that, we're actually going to palpate the liver as well. So we're going to get our fingers there. Listen for sounds. And then we're going to set our patient back up for comfort. So now we're going to go through our cranial nerves. So we're going to start with our olfactory, which is smell. So we would have them smell, see if they can smell anything. We could have certain specific smells in here, have them close their eyes, see if they could identify those smells. That's one way to check it. For optic, we're going to look at sight. So can you tell me what time it is?
6:20.
So we can see the clock on the wall. The next thing is oculomotor. So we're going to assess our pupils. So I have a flashlight in here. We're going to look at our pupils, make sure we have equal reactive light and accommodating in each pupil. Can you look at me over here? Can you look over there? There you go. Just trust. Perfect. So that's going to be our trochlear. Then we're going to go with trigeminal. Close your eyes. Where am I touching you?
Right cheek,
How about now?
left cheek.
Perfect. So we've already checked the abducens because we know he can move the eyes well. So we're going to see, can you raise your eyebrows? Can you smile for me? So that tests our facial nerve. The next would be we could do a hearing test that would test our vestibulocochlear. And then, can you swallow for me? So that's going to test our glossopharyngeal. For our vagus nerve, we've actually already listened to the bowel sounds to know that we've got active peristalsis, and we've already tested a heart rate, which is in the 80s, so we know that we don't have a vagus nerve being stimulated because we don't have a low heart rate. We've seen him move his head this whole time, which tests our accessory nerve. And then, will you stick out your tongue for me and put it back? So now we know that the hypoglossal is intact as well, which tests all 12 of our cranial nerves. So now with our neurologic exam, we're moving on to our deep tendon reflexes. So we are going to start with our bicep exam. So we're going to have the patient relax their arm, bring it in, muscle goes. Okay. So we would check that bilaterally. And then we're going to do our tricep exam. So we're going to have the patient relax their arm comfortably here. Make sure they're dependent on you. All right. Then we're going to check a patellar reflex. All right. And then the last we're going to do is the Achilles reflex. All right. And again, we would check that bilaterally on each side, looking for any kind of decreased or hyperactive reflexes, which we are all normal on currently. For our last system, we're going to check the musculoskeletal system. We're going to start with the spine. So we're going to check right and left lateral rotation. So we're just going to see if you can twist at the hips. And then we're going to check lateral bending. So if you put your arms on your waist and then just kind of tilt over. And then we're going to check flexion and extension. So we're going to have them bend over. And then we're going to have them lean back. So that's going to check all of it. We're going to move to the shoulders. We're also, at this point, we're going to check for crepitus as we're doing it. So we're going to have them lift their arms up. So this is going to check for abduction. We're going to have it come in. This is going to check for adduction. Then we're going to have them move forward. Go all the way up. Check perfect range of motion. Listening for crepitus. We're going to have them come just back just a little bit. That's perfect. We're going to do that bilaterally, check on each shoulder. The next thing we're going to do is check on the hips. So we're going to have them stand with feet together. Then we're going to have them wide apart. So that's checking for adduction and abduction. Again, we can feel for crepitus in the hips here. So we've actually already checked with rotation in the spine. So now what we need to do is check for flexion. So we can have them step back and then bend forward a little bit. Make sure they bend those knees just a little bit. We're going to check each hip. We're looking for pain, crepitus, any kind of deformities that we're going to see here. Then we're going to look at the wrists and hands. So we're going to have them hold them up. Bring your arms back. Go down. And then we're going to go this way. Come back in. All right. And so that's the last thing we're going to do is I want you to touch your thumb to each finger. On each hand. All right.